Hi, it's Dr. Margaret Towolawi, and I'm coming at you live from ROI Summit 2025. And I wanted to take a few minutes of your time to share about how you can have your healthiest life now. Now, if you're not familiar with me, I am a family physician and lifestyle medicine physician based in the Seattle area. And I own a company called Nurture Well Center, which is an umbrella organization for my primary care practice, Nurture Well Center, and my dermatology practice, SkinStatMD, a holistic dermatology practice centering on skin of color and holistic skincare and supplement items. Now, for today, I want to focus more on the lifestyle medicine aspect of my practice. So people will often ask me, Dr. Towolawi, if you were to summarize all the things you do, because you do so many, how would you summarize that? And I tell people that I'm all about feeling good from the inside out and looking good as well. So that's how I merge the aesthetic dermatology piece of my practice and the family medicine, lifestyle medicine piece, where as a family medicine and lifestyle medicine doctor, I focus on 6 main things, which I'll go over with you right now, and then we'll go into more detail in a few minutes. So lifestyle medicine is a newer field of medicine to many people, but it's been around for 20 years. And it focuses on 6 main pillars. So nutrition, specifically plant-based nutrition. And I tell people, because oftentimes people will hear that, they get a little turned up. Oh, I don't want to be vegan or vegetarian. And I say, it's not about labels. It's really about being more plant forward. So yes, if you want to be 100% plant-based like I am, that's awesome. But if you just want to try to be 70%, 80%, that's still moving you towards in the direction of better health. So plant-based nutrition, pillar number 1. Pillar number 2 is stress reduction. So finding ways to manage your stress throughout your day, right? It's not just about going on vacation to get away, but having those moments in your day-to-day life, right? So pausing and breathing, meditating, seeking out support, therapy. I am team therapy. I feel like everyone should have a therapist in this day and age. So that's pillar number 2. Pillar number 3, getting enough sleep. So restorative sleep. Lots of us are burning the midnight oil, up all night, trying to get things done after the kids go to bed. I've been there, I've done that, right? But it's really the restorative sleep that helps us be our best self. So pillar number 3 is sleep. Number 4, movement. Now notice I didn't say exercise. I feel like when I say exercise and I ask people, they think about going to the gym, that gym rat mentality, and it's an issue of cost and time. But I switched it out to saying movement, because that could be anything like dancing around your house, putting on some music, dancing around, right? That could be doing some chores. That could be jump roping, playing with your kids, line dancing. And of course, also going to the gym if that's your thing, right? Getting outdoors and walking. So having daily movement as part of your, your norm. So pillar number 5, social connection. So that's often overlooked. People don't realize how important it is to have community. When you look at studies, evidence-based studies, folks who have a firm foundation as far as friends, family who support them tend to have better health outcomes and better mortality rates. So they live longer and have better quality of life. So finding your tribe and contributing to that tribe and receiving love and giving love, right? And then the last pillar is reducing risky substances. So alcohol, tobacco, and illicit drug use. So just to recap real quick, going backwards, if I can try to remember it all. Reducing risky substances, having healthy social connections, having a more plant-forward diet, decreasing your stress, getting enough movement, and having restorative sleep. So keeping in mind all those 6 things as a way to reverse, prevent, and treat chronic disease. So that's the foundation of lifestyle medicine, right? Now the family medicine piece, most people know what that is. I'm a general doctor. I take care of babies, children, adults, and elder folks. So when I was training, when I started my medical training in 2006, we would say we take care of folks from the cradle to the grave, which sounds kind of morbid, but it's just the truth. So across the lifespan. So it's really awesome as a family physician and lifestyle medicine physician to merge those 2 things together to help people really live longer and have better quality of life, right? And I went into private practice about almost 4.5 years ago when I opened up my primary care practice, Nurture Well Center, as a direct primary practice, DPC for short. I was frustrated with the traditional healthcare system, like many people are. I hear the complaints. You can't get in with a doctor. When you call the office, you're on hold forever. You call for a concern, you can't get through to the doctor. So direct primary care just does just that, helps you get straight to the doctor directly, right? So longer appointments, better access, no surprise bills because there's cost transparency. We don't bill insurance, so we can see anyone with any insurance plan because we don't bill your insurance, right? And if you don't have insurance, it's not a problem because we also don't bill insurance, right? So it's been a really beautiful way to practice care. Through my practice, Nurture Well Center, I've been able to do things like shop with my patients, right? I'm really big on food as medicine. I'll be honest, if I can say this, it's my show, so I'll say this. The standard American diet is frankly just that, SAD, sad, right? I tell people either your food, what you choose to eat on a day-to-day basis, is pushing you towards disease or away from it. And I'm on the side of helping people move away from disease. So I walk that talk, I talk it out, walk it out, whatever with them, right? So I actually go into the stores and help people shop. Love doing that with my patients. And then I also, on that note, walk with my patients. Movement is such a good way to boost your mood and also help with insulin resistance. As many people know, we have a diabetes and prediabetes epidemic in the United States. And just going for regular walks, especially 15 minutes after a meal, not even for that long, even just for 15 minutes, can help with your blood sugar levels and boost your endorphins and get you just feeling better about yourself in the day, right? So I really want to share some practical tips on how you can go about approaching taking charge of your health. That's why I love lifestyle medicine, because it's not about pushing pills. If you follow these 6 pillars and try to make, leeway, picking one pillar to focus on, and for many people, I like to focus on food because that's what I see killing people, especially when we talk about people of color. I'm a very proud Black woman. I see everybody, but I have a lot of Black women patients. And as Black women, we're often the ones carrying the load, the mental load of, running our businesses, running households, taking care of children, being that auntie to people. And I found at Nurture Well Center to have a space for patients to feel nurtured and cared on, because we're always the one, especially women, trying to do that for everybody else. So not using, food as always a comfort, but using food as a way to fuel us, right? On that note, what I love about being plant-based and essentially eating the rainbow is the food energizes you. God gave us these plants and herbs for a reason, I like to say. Everything we need is right coming out from the earth, right, if we choose wisely. So then I wanted to kind of segue and talk about SkinStatMD and why I created that line and why I went into that practice. So I knew as a family doctor, I saw so many patients over the years who had acne and eczema. And as I started to study these diseases a little bit more, I found there was a huge connection to diet exacerbating acne and eczema, especially inflammatory foods, which are highly processed, and even things that contain dairy, that were contributing to these diseases. So I thought, okay, if I could create a holistic dermatology practice where I had an hour with my patients and could talk with them about, yes, I could easily say, try this skincare regimen, and if you need this medication, I can prescribe that. But how powerful would it be to spend more time with them going over their nutrition, going over their stressors? Are they sleeping enough? Are they getting enough exercise? Because all these things affect you long-term and affect your skin and your scalp and your hair health, right? So that's a really beautiful part about SkinStatMD. I have the time with the patients to go over and create customized plans to help them feel better from the inside out. I always tell people my tagline at SkinStatMD is, it's always more than just skin, right? Because it's always more than that. It's what's going on the inside that I want to make sure is good too, right? And then when I started SkinStatMD, it was actually July 2020 as a telehealth practice. And then I was able to get a brick and mortar location when I opened up my private practice, Nurture Well Center, and expand SkinStatMD services to in-person services now. And I have some aesthetic services that I do as well, microneedling, chemical pills, Botox, weight loss management as well, but that's part of my primary care actually. Anywho, but as I was doing that business and it was starting to take off, folks would ask about skincare products and, doctor, what should I try? What's good for hyperpigmentation, so dark spots, right? What's good for sunscreen that won't leave a white cast on me because I'm melanated and I want to look ashy, right? And I thought, okay, let me go back to the drawing board, look at the research, work with some dermatology skincare companies, and then I was able to launch my line, SkinStatMD, which is available to anyone nationwide. I have a full line, everything from facial washes, cleansers, moisturizers, sunscreen. Yes, sunscreen for melanated folks and folks who aren't as melanated. So it's very skin tone friendly in that way that I have two options. I have a tinted and untinted sunscreen, which is great. And then I've also expanded to products that address hyperpigmentation, because when I see predominantly folks who are melanated Black women, that's a big concern, how to even out skin tone from post-inflammatory hyperpigmentation, either from acne marks or ingrown hairs or even melasma, which is a common condition we see in hormone changes. And then speaking of hormones, as someone in their 40s, probably in their 40s and perimenopausal, I'm starting to see a lot of patients who are also perimenopausal and even menopausal, and that affects our skin as well. So my products are very sensitive, skin friendly, hydrating as well. That was very important to me. And then I can't talk about products without wrapping up talking about one of my best sellers, my oat butter. So as someone who treats patients with eczema, I know that it affects predominantly Black children and Black people, honestly, and people of color. So it was important for me to formulate my own eczema products. That's my oat butter formulated with colloidal oatmeal, which has been used since the ancient Egyptian days for its anti-inflammatory and antifungal properties. So check out that product as well, oat butter. And then lastly, I'll wrap up with my supplement line. So many people, know that the supplement market is $1 billion industry, right? And supplements, obviously I'm a fan of supplements, but you want to make sure you're using them wisely, evidence-based, and how do you sort through the noise and know what's good out there. So I came out with 2 supplements, my vitamin D3 low sugar gummies. We know, especially living in the Pacific Northwest, where I'm based out of, folks tend to have lower vitamin D levels. And studies have shown, especially during COVID, that folks who had normal vitamin D levels tend to have better COVID outcomes. And when we think about who has low vitamin D levels at baseline, it's typically people of color, because our melanin makes it harder to absorb vitamin D from the sun. So it was really important for me to come out with a vitamin D supplement. And vitamin D isn't just for, immune support like we found with COVID, but it's good for bone health. And then we're finding mood support as well, helpful for normalizing your cholesterol and even your blood sugar. So you can check out my vitamin D supplement line under my Dr. Towolawi's Wellness RX line. And then my last supplement that I've come out with are my wellness mushrooms. So I'm really into adaptogens. So you may have heard of adaptogens that are popular right now. Ashwagandha is one of them. But an adaptogen is any supplement that helps to naturally improve your cortisol levels. And who doesn't want that? We're often a little stressed and strained these days, right? So it was important for me to come out with a line of wellness mushrooms. So if you may have heard of things like chaga, turkey tail, reishi, lion's manes, those are all great for their mood support, stress reduction support, and even immune support when you look at turkey tail. So I have a blend of 10 mushrooms. I promise you they don't taste like dirt. They taste amazing. Yes, I'm biased, but I've got enough feedback to believe that myself. And it has a natural raspberry flavor, not artificial, that's infused. And yeah, I've gotten great feedback. So I would love for you all to, if you are not in Seattle, there's a way you can still have access to my wellness products through online purchasing. And then as a family physician, it was really important for me to make sure I had something that was out to help children, take charge of their health at a young age and feel educated and informed. So I have a line of books, specifically my book centered on nutrition, right? So I have a book called Ayomide and Shay's Kitchen, A Kid's Guide to Plant-Based Nutrition from A to Z. It's a love letter to my patients and families to really have a tool for families to have to read to their kids and take shopping with them, to guide them in the store. So it's a bite-sized nutrition book for kids, going through the alphabet. It rhymes, it's bright, it's colorful. I have a great illustrator, Annabelle Ortiz, who illustrated the book for me, and it's also available in Spanish, right? So, and it's not a basic nutrition book, okay? It starts off like A is for apple, but then we're talking about fiber and glucose and iron, and have various cultural references so that kids of colors read the book, they can see themselves. And I put my own kids on the cover because it's so important for Black and brown kids to see that eating healthy is not a white thing. It's for everybody, right? And I'm so passionate about food as medicine. So all that to say, I really wanted to wrap up and thank you all for listening this far. If you're in Seattle, you can work with me directly with patient care. And if you're not in Seattle, you can still have access to my wellness offerings through shopping online, checking out my books, supplements, skincare, and even I have a nutrition app that's available as well. So you can head to MargaretTowolawimd.com, my first name, Margaret, last name Towolawim, as in Margaret, or M as in medical, I should say, D as in doctor. So MargaretTowolawimd.com, where you can find everything I talked about today. Go forth, be well, Now's the time to be your healthiest you. You deserve that to yourself. Take care.